Good morning, good afternoon, and good evening, everyone. I welcome you all to the 1783rd day of uninterrupted webinar session of IFPH. And we all know that IFPH is conducting three webinar sessions every day. And now we all gathered here for a English session. Let's start the session with the silent prayer. Thank you. Today's chief guest is Dr. Upendra Kumar Verma, DHMS MD. And he is having a professional experience of 33 years and having 29 years of teaching experience. At present, he is a vice principal professor and HOD in the PG department of Organa department at GD Memorial Homeopathic Medical College and Hospital, Patna. And he is a member of Board of Study, Himachal University, Shimla. And he is a PG examiner in Maharashtra, UP and Bihar, and UG examiner in HP, MP, UP and Bihar, etc. And he has presented scientific paper in World Homeopathic Congress, and he has presented several papers at PCH workshop, and he also presented papers in several scientific seminars. I welcome you, Dr. Upendra Kumar Verma.
Thank you,
can
Dr.
start the
Shweta.
session.
Thank you,
Yes,
Dr.
sir, you
Shweta.
can start
I
the
hope
session now.
I am audible now. Okay, so
Yes, sir,
first
you
of
are
all,
audible. You please
okay,
take,
thank you. Thank you, Dr.
sir,
Shweta.
You
Okay.
please take 45 to 15 minutes for your session, and you please allot last 10 to 15 minutes for the discussion.
How many times? How many minutes for discussion?
45 minutes to 15 minutes you can take for your session, sir. Please allot the last 10 to 15 minutes for discussion.
How many minutes? 15 minutes.
You can talk. You can talk up to
45
50 minutes. 50 minutes तक you
50,
can talk.
50 minutes I can talk. 55 and 5 minutes for that. Okay, for discussion. Okay, fine. Fine. There is no problem at all. So thank you very much. Once again, I'm here on International Forum for Promoting Homeopathy. And good evening to all of you, whosoever is attending this webinar. And I hope that today's session will be helpful for all of you, because today, whatever the session I am going to start, just a minute. I'm just sharing the screen. Okay.
It's fine, sir. It's fine.
So, okay. If it is fine, then okay. So, today's the topic is the importance of follow-up in homeopathic practice. Now, this lecture is especially designed for those who are the practitioners. So, this is how much this is the important, that what I wanted to communicate all those doctors and practitioners, that even if you are qualified, and if you are prescribing some medicines to the patients, and if you don't know how to observe these things, and whatever the patient is saying, whether it is related to his recovery or her recovery, or it is on the path of cure, or it is just getting worse. So for understanding those things, one should know that after administration of a dose, what is going to happen with the patient. And if your observation is not correct, then the case may be spoiled. So after having so much labor in the case taking, and after selecting a dose of medicine, if you are not in a position to establish and to understand the patient, whatever the patient is telling, whatever the patient is giving the details, if you are not enough intelligent to observe those factors, and if you are giving medicines again and again, if it is not required, then case may be spoiled. So this is what I wanted to focus over these points today, with the importance of the follow-up homeopathic practice. Now, as we know that it is a very simple, that a homeopathic practitioners, whether it is a very much experienced, whether it is a new doctor, whether it is a somewhat qualified doctor. So if they are practicing homeopathy, definitely he will take a case, and after taking a case, a suitable medicines will be selected according to his knowledge and according to his experience. I'm not saying that everybody is aware about this, that if a patient is sitting in a chamber of a doctor and whatever case taking he has done, and the same patient goes to the next doctor, and it is basically to the homeopathic practitioner, and he will be prescribing or sketching something else. So it happens, so many times it happens. So in spite of having so much qualification, so much experience, and what a physician, suppose that I am a practitioner and I have given a dose to the patient, and if next time he is coming to me, or she is coming to me, then I must be excited to know that what the patient is saying about the dose which I have prescribed. For that, I am very much excited. I don't know that what the patient is going to say to me. And now on this saying, after administration of the dose, whatever the patient says, all the theme of recovery, cure, and whatever the fate of the disease is going to be established and decided on, it is in the hand of the physician. If physician is not enough capable of understanding those factors, so he or she may spoil the case, even if it was going to be cured. So let us know that what are the factors that is very much important in this follow-up. So what is to be observed in the follow-up? Naturally, what one can expect. So I know that everybody must be knowing the factor that there are three possibilities after a case, after administration of a dose, after taking a case, and that is either good, bad, or status quo. So these are the 3 points which one can see. Patient may come and say that, doctor, I have no improvement at all. Or the patient may say that there is some amelioration. So that will be the good for the physician as well as the patient. But it might be possible that the patient say that, no, doctor, the symptoms has been aggravated. So it is, for the patient, it is bad. But sometimes what I am going to give the lecture on the point is only that even if it is aggravation, if from the patient side, if it is a bad, then it might be possible that from the doctor side, it must be good. And similarly, if the patient is saying, yes, doctor, I'm improving, so it may be better for the patient, but it might not be good for the doctors, because he is understanding that what is the case and what medicine he has prescribed and why it is showing this thing. So these 3 points we need to understand actually, that why this is happening. So as we know that we are the physicians, and one thing I would also like to focus here, especially that the follow-up for what I am saying, it is the importance, it is only in homeopathic practice. It is not in other practice. Because everywhere, wherever the medicine or dose is being given, if it is improved, that medicine is being repeated in modern system of medicine or so-called allopathic system of medicine, or even in the other system of medicine also, whether it is a Unani, whether it is a Ayurveda, they will be repeating the doses if it is improvement. But for homeopathy, it is not like that at all. That if it is improving, we should repeat the dose. No, it is not at all. So we need to understand the importance of the follow-up in homeopathic practice, especially in homeopathic practice. And here, I would also like to mention here clearly that these phenomena, whatever I am going to discuss about the follow-up, is only possible if you are strictly prescribing with the principles of homeopathy, that single minimum and 1 dose at a time. If you are giving multiple doses along with the patient, it is absurdity to study such things, to follow up. So it is strictly for those practitioners who practice with the single and minimum dose according to the requirement of the patient. So let us see that what are the phenomena during follow-up we can observe. So let us start with, these are the 3 things: no change, that can be said by status quo; that the patient says that there is no improvement at all. And second patient may say that, yes, there is improvement, doctor. So I'm feeling better. And third is aggravation, that he or she says that might be disease aggravated or what condition have been taken place. So there is aggravation. So it may be bad for them. And whatever I have decided, that I will let you know that if it is a bad for the patient, it may be good for the physician. And if it is a good for the patient, it may be bad for the physicians. So that is to be understood today, that what is the importance of the follow-up. So everything depends upon the case thing. Priority. This is the priority. And where mistakes is being, where the mistake is there, suppose that a practitioner is having experience of 2 years, so he will be also taking a case. If a practitioner who has experience of 10 years of homeopathic practice, he also be taking a case. And if a person who is experienced with the 40 years, 30 years, 50 years experience, he also be taking the case. So there is a difference, because a physician who is only having practice of 2 years, he cannot think so many aspects. His observation is limited. So such things, such phenomena is a very common. It is not like that it cannot happen. It happens. It happens. Why it happens? That experience counts. And not is the homeopathy, but in every system of medicine, this experience counts. That if you are experienced, then your procedure of treatment will be according to your experience, whatever you have observed in the previous life, previous time of the practice. So case taking is very important in homeopathic practice also. Case taking is being done in allopathy also, in the modern system also. So they are doing just to know that what is the family history and past history, but there is no correlation. There is only correlation to understand that whether the disease is propagated one generation to another generation or not, whether it is hereditary or not, whether it has been transformed from one generation to other generation or not. But they are hardly concerned that if the past history has been like this, so this might be happen. So their study is not like that. But in homeopathy, we have a study like that, that what the past history since her birth, whatever the symptoms, whatever the disease the patient suffered, and what their parents suffered, even the grandparents suffered, all are linked together to understand the phenomena of the disease which is occurring in the patient, what type of the patient, what type of the diseases he is facing, what type of mathematic background is there in particular patient. So that is established through the case taking. So case taking is very important, because without taking a case, one cannot decide that what medicine is to be selected. And as I told, that the case taking is different by the different physician according to his experience and according to his knowledge. So after the case taking, if a patient is being given a medicine, a dose of medicine, and if there is no change, I'm saying first I am starting with the no change. If there is no change, so what can be cause of this no change? In spite of the physician has taken lots of efforts and has sketched better way during the case taking. So what might have taken? So the most in the case taking, if there is no change, if the medicine has been prescribed and if there is no change, then it means that the first point is that a point I have mentioned, a point may be that the most similar medicine could not be selected. And why it happens? Because either the patient did not disclose some of the matter which was essential for the prescription. It might happen. Or second, or the physician was not enough experienced or capable to penetrate into the case and not understanding that what the case was there. Why I'm saying this? It might happen that the patient also here the acumen of the physician, acumen and experience of the doctor is counted here. that he should know if the patient is telling some factor. So he should critically analyze those things, that what actually is happening in the patient's life. And that is to be understood properly so that a proper dose is to be given. If the patient if the patient hides something, then the physician should be enough intelligent to take out from his mouth the words that whatever, and it can be taken by the attendant also. And the physician was not able to penetrate into the case. I mean to say that there may be sometimes that, as we have studied related to obvious cause, that there may be obvious cause. There may be several incidents has taken place which he is unable to disclose in front of the doctor. But if doctor is not enough intelligent, if he has not capability to assess the age of the patient, and might be with his experience, he should understand that what can be behind this phenomena. I'm just quoting here so that you can understand the thing. A case came to me of a lady came to with her daughter, age about 26, 27 years, and she came that she is not taking meal properly. She is suffocating. Her breathing is not proper. And he just hinted me that she is talking on the mobile long time. Very, very longer duration. She is on the phone and she is vaping also. So these 3, 4 factors she could reveal me, her mother. But when I asked the patient was also not able to say anything. But mother said one thing, that she is working in the Pune and she has come for some vacation for since last 7 or 8 or 10 days. But she is continuously on the phone. She is not taking the meal. She is suffocating. Then what I wanted, that I should ask some obvious cause, or so I should ask some other question related to her personal life. But I thought that mother maybe feel offended. The daughter cannot reply proper in front of mother. So I requested her mother that please, can you leave for 1 minute? I want to ask you a question. Then she told me that no, it is not required. My daughter is very excellent, very full of character. If she is not characterless, that you want to ask in separate way. So I did not argue much, but I thought with my experience that the life of the Pune, college life, office life, who is unmarried, how the life is going on, and why she is talking longer duration on the phone. So I decided that there must be some disappointment and something dispute between the friends or something else, but it was not disclosed to me. It is just on the experience. I gave the Ignitia 200, 2 doses, 1 dose in the clinic and next in the morning, and along with the placebo, and asked the patient that bring her after 5 days. And believe me, that after 5 days when patient came, mother and daughter was perfectly all right. She was not suffocating now. And now mother told me, doctor, she's my daughter. You ask so many questions, whatever you desire. I am sitting outside of the chamber. So I told that no, my work has done and the medicine has also done. So that is what I wanted to communicate here, that understanding after a dose, so if there is no change, it might be possible that the patient might not disclose so many things, or the physician is not able to penetrate in the case. That is why no change has taken place. This is the first point of the no change. Second point, that medicine is right. The physician is enough capable. He has taken case properly. He has selected the medicine properly. That is a similar remedy. But due to some or other reason, the potency is lower than the patient requires. It means that the potency and dose is not according to the susceptibility of the patient. Now, here I want to communicate, or here want to convey all of you, that if a patient requires the dose of 200 or 1 mg, and if I am giving 30 potency, so 30 potency might not be arousing the primary action at the higher level, of the disease stronger, cannot create the stronger artificial disease, so that the disease, natural disease, can be combated, can be cured. So as in homeopathy, we understand that everything is dynamic. Disease is dynamic. So that is why medicine is being given dynamic, and the play of disease and medicine is being played on the vital force, that is also dynamic. So if it is a dynamic, and if it is a lower potency, is giving one dose, again I am just telling you that these phenomena can be observed only after giving a dose strictly to the homeopathic principle. Then these points, these things are valuable. Otherwise, it has got no utility at all. So, if medicine is being given, which has to be worked, and what we decide, what we hope with the hope of the medicine, with the dose of the medicine, what we think in our mind, that let this dose of medicine should be such in strength that it can produce a similar artificial disease, slightly stronger than the natural disease. That is what I wanted. And let us understand that if the disease strength, just imaginary, if the disease strength is of 10 power, let it be just a numerical value, and it requires the medicines of 11 power, so that it can be overcome with higher dose. But if I am giving the medicine of 5 points, 4.6 points, then it is not going to work, because it is not producing artificial similar disease stronger than the natural. So that is what, that the even medicine is right, even the potency and the doses, whatever the doctor has decided, it is not according to case, then we can observe that the patient showing that there is no change at all. Second point is that if the dose is not proper, so the primary action and secondary action could not be there in the vital force of the patient, whosoever has come for the treatment. And third point, that we are trying to observe the reaction little bit early. Why it happens that sometimes we used to give a dose like Calcarea car, Brighta car, or like the same deep acting medicine, let it be sulfur also. So if I have given the dose and the patient is in hurry, and if he comes or she comes, the doctor after a week or 10 days or 15 days, the doctor, there is no improvement at all. So here also the acumen of the physician is counted, that he should understand that whatever the medicine he has given, it is deep acting and it will take time to act. And just we are trying to observe the case little bit earlier. And if the patient is saying that there is no change, and if the doctor come under the influence of the patient, that if there is no change, that he should give another dose or another medicine, then it will be also a, it also is also going to spoil the case. So if a physician who is capable of understanding and how to take the case, understanding the medicine and understanding the dose, and if he knows that the medicine which has been given, it requires some time to act. So if it is little bit earlier visit, then doctor should give only placebo. And why I am giving and why I am telling that he should give placebo, because it is one of the way of the treatment. If the patient is impatient and he is telling that there should be something else, then a doctor should understand his problem, and he should understand that whatever the medicine he has given, it is correct and right, but he requires some more time to experience the reaction and observe the reaction of the medicine. And if the patient is impatient, then he must give some placebo. If he says that no, it is not required, I have given the dose, wait for another 15 days, then it might happen that the patient may go to another doctor. So this time also, so case may be spoiled. So mind it. So this is the time where one can give the placebo, so that the patient can understand so that the patient may be cured later. So this was, so no change. This is the third and the last point which I am going to focus, and that if those phenomena is not there, your case taking is good, your medicine is correct, I mean to say your remedy is correct, and the dose and potency is correct, and it should act. And even then, according to your observation, if the patient is telling that there is no improvement, then patient might be telling a lie. So how can this establish the patient is telling a lie or not? So for this, you need to be a keen observant. Why I'm saying this, keen observant? Because if you do not have the case taking record, so case taking record will help us here to understand that whatever the symptoms the patient told regarding his appetite, that there was a diminished appetite, or there was he was not he was not relishing the food, or he was not enjoying the food. Now he is enjoying the food. If the bowel movement was not good, now the bowel movement is correct. If there was flatulence, that is also correct. That is also improved. So there are so many things I have taken in the case taking. So if those points are being improved, then it is definitely showing that the patient is improving. So that is why I said that the third point of no change is just that the patient might be telling lie. So you can only understand that patient can telling lie after critically analyzing the case taking record, and after asking every question that how is this, then patient may say, no, this is better, but I am not feeling good. This is better, but I am not feeling good. So one should understand that whatever medicine he has given, that is the correct one, and the patient is telling lie. But I cannot say the patient that you are telling a lie. I cannot offend the patient. So these are the points which must be understood in respect of both things. So I have given several points that if patient come and says that doctor there is no change, then what we should understand about that and what might could have happened. Now let us see next point, that is amelioration. Now there is simple amelioration, that is observation of the relief amelioration, that is good for the patient. So a general feeling of better by the patient is definitely showing that the patient is improving, and it is a good for a physician, good for the patient. Both are happy here. But mind it, again, since I am observing, we are observing the follow-up. So symptomatic improvement, there may be a general improvement. So what can I understand with the dose, that what reaction has taken place? If the patient is saying just symptomatic relief, yes, there is a little bit pain relieved or little bit something, a bowel movement is there, but the core of the disease or the center of the disease or the chief characteristics of the disease has not been improved, then we should understand that what we are doing, whether it is a amelioration or palliation. So understanding those phenomena, that is palliation and suppression, one physician should understand properly that what is difference between palliation and suppression, and what is the cure. That phenomena is to be understood properly by a homeopathic physician. So on this, there may be some confusion. Suppose that the patient is telling, yes, doctor, I am having improvement, this. And one need to assess here that whether it is good for the patient, whether the dose is doing good, and the patient is improving step by step, or just we are providing the symptomatic relief. And again here, one thing I would like to again once quote, that these things can be observed only when the physicians have given strictly on the homeopathic principle, that is single and minimum dose, only then this phenomena is observable, otherwise it is worthless. So, how to understand that if it is a symptomatic relief, then whether it is a palliation and whether it is on the path of recovery. So how can, there may be confusion among the physicians that how can we assess. So there is some tool, there is a tool which I want to quote here, that through that tool one can assess that his dose and potency is going to cure the patient, or the dose and potency, whatever he has given, that is partially selected. So there is just palliation is taking place. So how to understand those things? So that is a phenomena, that is tools to understanding about this confusion that the patient is whether improving or whether the patient is on the path of cure or whether the palliation is taking place. So the deciding factor will be energy level. Mind it, this energy level is very much important. And this is a very, very grand characteristics which physicians should have, a keen observable eyes or understanding, or his observation should be such that he should assess these things in the clinic, as well as he should ask such questions of his daily events, daily routine life. Suppose a patient is telling that yes, there is some improvement in the joint pain, but if he is feeling low, if the energy low, but he is feeling that there is a lot of weakness, I don't have urge and I don't want to go to my office, I have lethargic, I have don't mood, don't urge to go in the office. And in spite of having improvement in his the problem, that is symptomatic. So here we can understand that the energy level is low. So it is a palliation and it is a not a good indication that patient is going to be cured. And on the contrary, if the patient is telling that even there is some evaluation, a general well-being, what I quoted, the general well-being. What is this general well-being? Here I would like to make you understand that it is written in the organon or in the philosophy, if the patient is feeling mentally better and physically, if physically it is not better, then we should understand that the improvement is good and it is on the right path. So how a patient can feel mentally better even in spite of his physical inability, or if his chief complaint has been aggravated? Yes, this is a very true question, and every student may ask that how can it be possible that if the physical complaint is aggravated and he is feeling mentally better? So it happens, it happens. So since there is not much time to show the things, but I would like to uh, communicate you that a homeopathic physician understands that the root of the disease which invaded in me, which came in me, and how it progressed, how it affected, how it manifested, we understand. We understand why I am saying, because we know the disease is dynamic, vital force is dynamic. So what is the first ill? So the root of the disease infecting or root of the disease, what we understand. Not I'm saying that the modern system understands that bacteria and virus and these things has affected. But mind it, this cannot be affected if you are healthy. If your mind is perfectly healthy. Unless and until you are, Dr. Kent has said that man is priorly sick before the invasion of bacteria and viruses. So if your energy is low priorly due to some or other causes, with a mental disturbance or some other disturbance, with the dispute of your friend, when you become a low, then it is the time where the invasion of bacteria and virus takes place. The root of the disease inception is from mind, then body. Similarly, our medicines also work in the same way. The medicines goes and understood by the mind because the medicine is dynamic. They are not giving some material dosage, it is dynamic dosage. It is in mind, and from mind it is copied and then the physical part. So at the time of, if just for making you understand, I just want to quote you one thing. If you are understanding, suppose that a disease, if you understand, if you homeopathic understand, then I can tell you that if a disease has manifested or rooted from mind to the body, then the primary action first taken place in the mind. So there is stronger disease invaded, and when the stronger disease there in the mind, then the normal natural disease has already been vanished, and then the progress to the physical part, let it be eczema, then it is being aggravated with the primary action of the medicine. So eczema is aggravated, but from the inside, just I am telling, it is not in the whole I am telling, I am just partially telling you that eczema is aggravated, but the mind is free from the disease. Hence, the patient feels better in spite of increased eczema, in spite of itching. So, and how it is better? Because previously he was having no mood to work, no urge, no driving force. Now there is driving force. Now there is mood. Now the patient is saying, now I am going to the office regularly. But the patient is saying, no, my complaint has aggravated. So here, the doctor should understand that improvement has taken place. So he should not give any dose here. So this is the thing which I wanted to focus over. That if the patient receives some medicine this time, right now, then the case may again spoil. So these observations are very much essential in homeopathic practice. And again, I am saying, and I have taken the topic also, that importance of follow-up in homeopathic practice, not in other practice. It is not observable in other system of medicine. I don't know because I have no idea about that. But whatever I have studied, whatever I have experienced, whatever my experience, that is I am sharing to you, that this is the thing which happened, that if the patient is now saying that now he is able to perform his daily works, daily routine works, his bowel movement is good, so now he relished the food, then this is definitely, and energy level is high, then it is definitely improvement. So it is the path of recovery. And if there is improvement in the physical part, but the patient is having low energy, if he is feeling weakness, more weakness, then it is not a right path. It is just a palliation of the medicine. And this palliation, because the physicians could not give the proper dose, it was just given the partial dose of the medicine. That is why this phenomena is being. Now, again, one type of amelioration that is as written in the Kent philosophy also, short amelioration, and this short amelioration is checked by some factor. Yes, it happens that physicians has taken case properly and dose is given to the patient with the right potency, right dose, and patient was improving also. But suddenly, the patient says that there is no further improvement. Then here, again, it should be analyzed critically that what might have happened. It might be that as we know and we understand that the coffee is the a good, or I can say universal antidote to the homeopathic medicine. Even camphor is universally antidote to the medicine. Now, somebody has taken acidic food, large amount of acid food, or somebody has taken the consumption of the alcohol, or if he has come in contact with other chemicals, which might be possible, I'm not saying the exact, which might have hinder the chain of progress of the improvement, what the medicine is going to do. So that was broken, that the improvement further is not being taken place because it is, just give me a minute. So medicine was correct and medicine was being improved. The patient was improving well. But if something has taken or ingested, or if the patient has come with the contact with a large amount of perfume or some chemical, then it might be possibility that it might has hindered or checked the progress of the action of the medicine. So this is to be asked with the patient just to understand that what phenomena might would happen inside the patient why this happened, that after giving a proper dose, proper potency, after taking a case, a remedy is selected and remedy was working well. And at the time, so one doctor should ask that, my dear, what is happens? Have you come with this and this thing? But if the patient says, no, doctor, I am religiously taking the medicine and I have not come into the contact either to the coffee, camphor, or some chemical, then the physician should understand that there must be something like medicine, some inflammatory grade of symptoms inside where the medicine is required frequent uses, or it might be possible that there is some gross pathological changes inside the organ, and here it is required. So this is what I am wanted to tell you, that suppose a proper case taking is being taken and a remedy is selected, and that remedy is suited to the patient, and if this phenomena occurs, so it is also a type of tester. Tester, you understand what is tester? Tester is that an instrument or a tool with which you can test the electricity is coming or not. That bulb is indicating yes, electricity is there. So this is also a type of tester in homeopathy, that if your dose is given proper and it was improving and it is checked, so it might be possible that there may be some structural change inside the body. That is why medicine is not acting properly. So that is why there is too short relief of symptoms, or it might be possible that the patient has come in contact with this and this, or it may be some inflammatory grade where some repeated dose is required. Whatever dose is being given, it is a little action, so it required frequent repetition. So these observation decides that what is to be done in the case. Now, these are the things which is to be understood. That is the importance of the follow-up in homeopathic practice. This should be understood. If one is not understanding this phenomena, then in homeopathic practice, the case is going to be spoiled. Now, one amelioration is that first the amelioration comes, then aggravation indicates that three things, that what the disease is incurable either, or the medicine was superficial, it means the partial, and the case should be examined critically whether relapsing or maintaining cause is still operating. So it might be possible that after amelioration, then aggravation taken place. It happens all the time. Whenever we administer a dose of palliation, then it improves. But later on, what happens? That the patient again it is aggravated, because palliation is for short duration and disease has not improved at all. It is just palliated, just improved, and later on the disease progressed on its own accord, and that is why the disease is again showing its effect and aggravation is observed. So sometimes it also happens that the medicine was given and then aggravation taken place, then there was no improvement. So it might be possible that there is some maintaining cause may be there, that is maintaining the disease, and it happens so many times that we forget to observe those things like occupation, etc. So there may be some occupational problem. I'm just quoting a case of someone from which I heard that some medicine was a patient came with the joint pain of the fingers and came for the medicine. He was given some medicine and he improved well. But again, he came that there is no problem. Doctor examined the case again and again. He found that the medicine was right. But in spite of improving, again, he is feeling the pain and aggravation. Then suddenly he the patient told himself that it is very difficult to hold the ice also. Why? Because he was the person who was selling the ice ball of ice cream to the boys of school boys and girls just by rubbing and crystallizing the ice. So it was his profession. Then doctor came to know, oh, so this is the maintaining cause which was working, and that is why the finger joint pain was not being controlled. So such phenomena and other phenomena, there are several like MR, medical representatives, if they are having piles, because maintaining cause is this, that they are taking the foods off and on of the different hotels, and the spicy food they have to take, or they need to travel for a longer duration, longer time. So hemorrhoids and piles are being aggravated every time, even in spite of taking the medicine. So it happens with the maintaining cause also. So these phenomena should be understood by the homeopathic physicians, that what is happening is amelioration. Now, one amelioration is that in which the patient says after 15 days, that the first 4-5 days there was aggravation and then amelioration took place. So this is the perfect observation, and this is what every physician want to observe, that let the patient he feel happy, that if the patient says the doctor there was a lot of trouble up for 3, 4, 5, 6 days, and thereafter now it is ameliorated, now for a week I am feeling much better. So this is the perfect example of homeopathic medicine and homeopathic dose and proper case taking, proper remedy selection. It gives the indication. Now here also, what I want to communicate here, that also here sometimes it mistakes happens with the doctors, that the patient has come, now the amelioration is started after aggravation, now the patient is on the path of recovery. Here again, if doctor give the doses of medicine, so it will spoil the case. If he is not understanding, he will understand. If he thinks that he gives another dose, it will work more efficiently, then it will be a mistake of the doctor, and again he is going to spoil the case. So the most desirable observation of homeopathic physician is this, that the first aggravation, then amelioration. But if here some mistake is taken, if mishandling is happened by the compounder, by the assistant or somebody else, then it might be possible that it will spoil the case. Now the aggravation, third point, that is patients say that it is worse than bad for the patient. But what I told just now, that for the physician, it might be good if it is observed in priorly the first dose when given. And if there is aggravation, then evaluation come. If the patient comes within 4-5 days and first week of the dose is given, and if that time, if it is aggravation, if the physician and doctor is enough capable and intelligent and experienced, then he can understand with his tools and with his acumen that this is the time of homeopathic aggravation, and he should be able to understand what is homeopathic aggravation and what is the medicinal aggravation. Then he will understand that he should not give the dose of medicine here. It requires only rubrum, phytum and placebo and nothing else. And then he should wait for the dose. So, in this confusion in homeopathic physician in evaluating aggravation, there also case may be spoiled if the physician is not enough experienced and able to understand the different types of aggravation after administering a dose of homeopathic medicine. If he or she is not understanding proper that what reaction may it occur, then if his or her observation is not proper, if he or her observation, if if the physician is not working according to observation, then a dose or medicine may spoil the case. So third aggravation is the homeopathic aggravation. What I wanted to communicate, this is the main. It is a simple and is followed by amelioration with energy level high. As I just explained you that how energy level is high, and indicates that it also indicates that our medicine, my medicine was correct. Disease has not progressed to the structural organic change also, and disease is curable. So if this phenomena happens, After aggravation, then amelioration, then we can establish the fate of the disease, that yes, it is curable, and doctor should understand that he is not able to cure the case. So aggravation, the homeopathic aggravation, advised in follow-up, never use any medicine during the aggravation, never administer any medicine during amelioration, and aggravation, a prolonged aggravation, because time is short, so I'm just going through this slide, 3 or 4 slides. Such aggravation is met where the physician has used deep acting and constitutional medicine, where the structural change of vital organ has already taken with. It is just as we can observe in the second observation of Kent, and this is the first observation of the Kent, that is killer aggravation. So this is observed due to fault of the physician due to inadequate knowledge of pathology and practice of medicine. It is due to whimsical approach of the physician that he will cure the case with deep-acting constitutional single dose with a high potency. The primary action of the medicine could not be reacted with the secondary action of the vital force. What is happening? That if a patient is suffering with, of course, he is a psoriatic patient, of course, is some pathological changes there, and doctor is unable to understand that patient condition is deteriorated. Here, if doctor with his approach that he will give an antipsoritic with higher potency, and this higher potency it produces the primary action, but there is not enough energy in the patient that the secondary action could be brought. So this primary action of the medicine, with the help of the disease, it is aggravated violently. So it may be said that it is the clear aggravation. And here also the doctor should have patience. So if here again a dose is given something, then again it will spoil the case. So in the clear aggravation, what is to be done in such cases? In gross pathological changes, we should use only medicine which can provide palliation. Homeopathic can provide palliation without any pain in such cases. Why I am saying this? That I have just told that there may be some pathological, advanced pathology like advanced case stages of cancer, where the homeopath is also examining and taking the case of such patient who has been suffered and treated with allopathic after chemotherapy, amputation, radiotherapy. Then the doctor said that now there is no need to take the treatment. The patient is still suffering, metastasis has taken place in the whole body. Now here the homeopath can provide some relief to the patient with the help of palliation. So here palliation is required. If he is sleepless, then he should provide some medicine so that he can sleep well. There is burning pain, it should reduce, and the life longevity is also there. And now the last one is the medicinal aggravation. So doctor should know that what is the medicinal aggravation. He should be able to understand what is the homeopathic aggravation, medicinal aggravation, and disease aggravation. So in medicinal aggravation, it happens that the patient was not being given the correct medicine. Some other medicine was given, not according to the case, but that medicine was not a single, but it was multiple and given frequent time, and it can produce some medicinal symptom to the patient. Again, here doctor should understand that these are must have the knowledge of materia medica, so that he should understand now the reaction is like that is the medicinal proving has started. So he should stop or antidote the case. Now there are must be differentiated like medicinal system, new symptom which are not in. That is to be understood that if the patient is having some new symptom, then doctor should have capability of understanding that whether it is the medicinal symptom or disease itself have progressed to the longer duration. So it is complication of the disease. So that is to be understand, and he should understand that what is the prognosis of such cases. So these were all, and I hope that I have finished my topic within 55 minutes. And if there is some question, I am ready to answer if somebody has asked.
Yes, sir. Thank you, Dr. Verma, sir. It was a very interesting session. And as you said, as a homeopathic physician, we should be a good observer and we should first focus in our case taking.
Very right. So any question? If there is any question, I would like to.
Yes,
Doctors, if you are having anything to share, if you want to ask some doubts, you can turn on your mic and you can.
yes, yes, sir. It's really a very good session indeed. And you really show how a homeopathic student or a doctor need to look into the importance of case taking. As we have no time for discussion, already our
Yes, actually,
we can
in
have a
the
second part of the same so that we can have more discussion. Only half
okay.
half the part is over, I think.
So I hope that my lecture is. I don't know how many physician has understood or not understood. So whatever there was in my mind regarding importance of follow up, and I once again I would like to focus that it is only possible in homeopathic practice and no other system it requires to understand these follow up. So our follow up is very important in homeopathic format. I hope that every doctor had and must have understood. Thank you very much.
Yes. Thank you all for participating in this session. Thank you once again, Dr. Verma sir, for such an excellent session.
Okay, sir.
And tomorrow we will have a session from Dr. Shelly Sharma Bhosle, and Doctor will be talking about pediatrics and homeopathy. Hope all of you will join us
Okay, sure,
at
sure, sure.
the same time. Thank you all. Good night.
Okay.
Over to Dr.
Thank
Mariam
you, Doctor.
to complete the Malayalam session.